Searching for effective and safe solutions is the true purpose of Boiron Laboratories, and because your health merits the greatest of respect.
Throat infections can be a pain to deal with, and often they interfere with one's day-to-day activities, like interacting with people and also when it comes to eating. So to chat to us more about how these infections come about and also the natural solutions to treating the symptoms associated with them is Dr. Jacquelyn Schultz, who's a homeopathic practitioner. So Jackie, in terms of this sort of area, we've got the throat and we've got the larynx, which often people don't really sort of create a distinction between. It's just whatever's happening in the neck, basically. So what are the two distinct aspects, maybe I can say, that we're talking about?
Well, most people really think they're the same thing, and they're not. They've got very distinct features. So essentially our throat, which is our pharynx, is this big muscular tube that extends from the base of our neck up to the top of our trachea, or our larynx area, up to here. And what it does is it essentially moves our food down when we swallow and our air.
Okay.
So we usually divide into three sections. We've got our nasopharynx, where if you trace your nose to the back where your throat is, that's our nasopharynx. Oropharynx behind our mouth, and laryngopharynx is around our larynx area.
Okay.
And lots of issues occur there, but it has very distinct functions in the body.
So now, when we talk about throat infections, which part of that system is being affected?
If we're talking about throat, we're talking essentially anywhere from base of neck down to larynx. So throat's going to be nasopharynx, not so much, because that's a little bit higher up. Definitely around our oropharynx and laryngopharynx.
Okay. So then an infection of some kind that we might have in this area, is everything affected at the same time, or are different areas affected in different ways from different issues?
So this is probably the number one question for most patients, because they don't know what to treat. They just don't feel well. So my standard response is try to work out where the issue is coming from, because then we know what to treat.
Okay.
And whenever there's an issue, there's going to be inflammation, pain, mucus, irritation in that area. So if we've got our throat area, which is essentially behind our mouth up to probably the base of the neck here, we're looking at our tonsillitis and our pharyngitis and just a typical old sore throat.
Okay.
But also a huge one is postnasal drip.
Yes. Oh,
because that's the all the time.
Right.
If we're going lower down to our larynx, now our larynx is a really interesting area because it has our voice box. And our voice box is this area that has two mucosal folds, which is our vocal cords, and the air moving through those vocal cords is what produces our sound in our voice.
Right.
So its job is to give us voice and vocalization, but also to move the air down to the lungs for breathing and coughing.
Right. If you get an infection, maybe let's start there. If you get an infection in the system, what determines whether it becomes nasopharynx or laryngitis or a throaty postnasal drip inflammation? What are the deciding factors, maybe?
So let's backtrack a little bit.
Okay.
You know how often we talk about viral infections being really challenging, because if you don't have an optimally functioning immune system, someone around you is walking around, they cough, sneeze, or even talk around you, and you inhale a little viral infested molecule of air. And if your immune system is not functioning at optimum, your ability to neutralize that infection is not going to be great.
Okay.
So depending on where that little particle goes to is where you're going to get that infection.
Okay.
So most of the time, all the symptoms we experience is actually our immune system launching this massive assault to get rid of that infection.
Are there sort of habits or things that we can do to prevent or possibly reduce the chance of getting a throat infection of some kind? Like, I mean, there's sort of old wives' tales about don't drink the cold water out of the fridge in winter, or when you're in a dusty environment, make sure that you do drink some water to clear out anything that's in there. What might be helpful?
So our throat area is definitely going to be, commonly a lot of people, it's the allergy component side, because that's what makes the mucus.
Okay.
So if you are prone to allergies, we're going to suggest being mindful of not breathing in someone's just freshly mowed their lawn.
Right.
Don't go outside and breathe in all that.
The void environment.
Exactly. You know what your triggers are. We also know smoking. Smoking definitely causes a lot of irritation around the larynx area. It causes the hoarseness, the gruff voice. A big one is reflux.
Okay.
Your reflux, your acid reflux coming up irritating the larynx will cause a lot of hoarseness, sometimes loss of voice, even pain in swallowing and difficulty swallowing.
Okay.
So the reflux component is big, heavy meals, certainly being overweight. Some people, it can be eating too late and then going to bed. They experience the reflux there.
Yes.
That acid also can burn that area and cause inflammation and symptoms. So it's not just always infection. And a big one is overuse.
Well, that's what I was going to say. Like, I mean, people who strain their voice, talking all day long, or shouting at a sports event or a music concert or something like that, that tension that you feel the next day, I mean, that's purely just overuse.
Purely overuse, which is going to cause the inflammation. The vocal cords are tired and inflamed. I mean, we all know the days of going to a concert and screaming, you amaze the next day, you're like, It's because those vocal cords are irritated.
Does that cause susceptibility to any sort of infection that might land inside your...
Anytime you strain an area, you're susceptible.
Right.
So if you allowed yourself recovery time, no problem. If you then carried on or were then exposed to perhaps a viral infection and your immune system wasn't great, you'll definitely get an infection.
Okay. Now, in terms of treatment, is this about reducing the general inflammation so that you are able to help your body and assist with dealing with whatever's going on in there? Or what are we actually trying to do if you want to treat these conditions?
Well, you have to know what you're treating.
Okay.
So if it's inflammation, infection, mucus, and allergy.
Okay.
So it's quite hard for someone not being examined by a practitioner to know what it is.
Right.
They're just like, something doesn't feel right. Obviously, if it's just overuse of a voice, or a lot of patients that sing in choirs or singing is their job, for them it's not an infection, but it's an overuse.
Right.
So what we generally want is finding something which is going to optimize the immune system to recover.
Okay.
There's always this magic word in homeopathy called homeostasis, which means you bring the body back to balance.
Okay.
So for me, it's easy. I'll recommend something homeopathic like homeovox, because this particular medication contains all the remedies that will address inflammation, infection, overuse, and mucus anywhere in that throat and larynx area.
Okay.
So it makes it easier for me to recommend it if I'm not examining the patient. I'm not sure exactly where the issue is.
And how is that administered? I mean, is it a syrup, a tablet? What's the process?
So it comes in sleeves of tablets, and these tablets are not ones you swallow with water, you dissolve them in the mouth. But we can give them to kids and to children as well, where we dissolve the tablets in water if need be.
Okay.
And administer it that way. So the safety profile is fantastic because you can use it for any age, pregnant patients, elderly patients, chronic disease patients, because it won't be contraindicated in a condition you have, a medicine you're taking.
Okay.
So it's relatively easy for me to recommend it because I'm not putting my patient at risk.
Okay. And is it something that's freely available over the counter? Do you need to have a practitioner prescribe it, or can you buy it straight away?
You can buy it from any of the leading pharmacies, the health shops. Many practitioners stock it,
Okay.
but it's very easily accessible.
Wonderful. Jackie, thank you so much. I think, again, I mean, we're heading into the season of issues, so something to keep in mind when you have a niggle that you want to deal with. So thank you for your insights.
Thank you.
Great.
Searching for effective and safe solutions is the true purpose of Boiron Laboratories, and because your health merits the greatest of respect.